For this video, we'll be discussing the approach developed by Carl Rogers known as person-centered therapy. So some things about it in a general sense, that person-centered therapy views human beings good at their core and naturally strive to be positive, that human beings are trustworthy and they are capable with what they already have to make changes to lead them to a life of productivity and even happiness, right? To be able to self-actualize, to really live out my full potential. But the approach focuses on that the environment can be a hindrance for the individual. So person-centered therapy wants to create an environment that is growth promoting, that helps the client mobilize their own characteristics and traits in order to really self-actualize and reach their full potential and really fulfill their creative nature. So the approach itself is really a reaction against directive approaches that are still popular today and were popular at the time, because this is a non-directive approach. So certain things such as treatment planning, assessment and diagnosis, these really aren't going to be emphasized in a true person-centered approach. So with that being said, a person-centered approach really isn't going to be suitable for insurance companies because it's non-directive, it's not goal-oriented, and it might not be a really great way to check outcomes. It also doesn't really have any specific interventions that go along with it. Intervention-wise, we're typically doing some discussion techniques to be able to be in this relationship with the client. And I strongly recommend anybody who's watching this video that they take the time and watch Rogers with Gloria because he really does a great job with paraphrasing, reflections, and being present in the relationship, right? Some questions, but most of the time, a lot of the discussion techniques that are taught as basic skills of counseling, they can be challenging at times. So it's not going to offer any specific interventions that are discussed in other therapeutic approaches. The counselor is also going to avoid things such as advice, suggestion, or direct intervention and teaching, right? It's a non-directive approach. And just for any counselor, it's important to, avoid advice or use it sparingly, if anything. And Rogers does a really great job of, with Gloria in the video, of avoiding giving advice. If a client's having problems with his boss at work and I tell him that he should talk to his boss about some of the interpersonal difficulties that are happening, and let's say it goes bad, the client loses his job, he could come back to me and be like, well, that was your advice, man. This was your fault. This was your problem now, right? Because I don't have all the information. I don't know how it's going to go, but I'm willing and always willing to help people facilitate decisions, right? And that's what person-centered therapy also allows us to do, is to learn how to be more facilitative as opposed to just using directions and directives. And to do that, we really emphasize the approach as a journey between two individuals who are not perfect, that we're both going to make mistakes, but we both in this relationship, the counselor and the client, are striving towards self-actualization. We want to be as therapists as genuine as we can, and that's our goal within the therapy session, to be able to create this growth promoting environment. So to do that, we focus on really three things within person-centered therapy, the first of which is congruence, and that's genuineness and realness in session, right? Am I being myself within session? Right? Am I to the point in my life where I'm able to be a congruent individual? And the second, once I'm congruent, I'm able to experience unconditional positive regard for the client, right? Regardless of what the client does, I have a sense of acceptance and caring towards the client, which can be tough sometimes if you're kind of new to this and haven't had a bunch of clients. It might be easy to think like, oh, it's easy. These people are going through some stuff. I could, easily have some unconditional positive regard. But we have personality clashes and everything. So eventually, everyone is going to come across people in their life that they don't just jive with. Maybe that they blatantly just don't like. The client might not like the counselor, and the counselor might not like the client. But that's where the third characteristic or necessary ingredient comes into play, and that would be an accurate empathic understanding. Um, and that is the ability to understand somebody's phenomenological perspective, right? To walk in their shoes just for a minute, to understand where they're coming from in life. And that's different than sympathy, right? Because empathy is that sense of understanding for the individual, where sympathy is really kind of feeling bad for the individual. And in a counseling relationship, that could lead to me being a little less objective and getting pulled into the client's stuff. So we want to avoid that, and we want to really strive to develop that sense of empathy, which can also be hard to do after listening to trauma stories a lot, right? It's easy to start to develop a sense of pity. In my experience, clients don't want that anyways. So we're really doing them a disservice. So these are the necessary ingredients that I need to create this growth promoting climate that exists. So in the therapeutic process, we really look for 6 conditions to be met for positive personality change to occur. And that's both of us, the therapist and the client, need to be in psychological contact, right? This is relationship oriented, which is different than like what a true behaviorist perspective would be, where the relationship's not really emphasized. But we want to make that contact with each other, that we both feel like we're in this relationship. It operates under the assumption that the client is experiencing incongruence, right? Inability to be real, or even have behaviors match up with internal core self and values, that there's a sense of incongruence there. But what's important for that is me as the counselor am in a state of congruence. Right, a sense of realness, genuineness, that my behaviors are able to match up with my internal core self. And then I can have that unconditional positive regard, experience that empathy, and importantly, I'm able to communicate this to the client in an effective way. So in this therapeutic approach, we're going to be highly focused on the quality of the therapeutic relationship, which is absolutely supported by current research, right? The client is more likely to get better if he or she right, has a relationship with the counselor or with me. So at the end of every session that I do in my own practice, clients take a rating scale that asks them to evaluate the session, to evaluate their sense of the relationship that they have with me. So I'm able to get some feedback and track it, and also track the client's progress throughout the therapeutic process. Right, we are able to openly express these feelings. Me as a counselor in person-centered therapy, I'm able to openly express these feelings towards the client in an effort to be able to get the client to strive towards positive goals, right? But I'm more of a fellow explorer. So if we look at some limitations of this approach, I guess from my own personal perspective with individuals who I've worked with, right, they appreciate things being added for them into what they do, right? Like if I have a client who's got some trauma stuff going on, and is having a hard time coping with some panic attacks or other anxieties, my clients come into therapy and want to know what to do to alleviate these symptoms. And a true person-centered approach, I wouldn't have much to offer them, right? So it might not be a good fit for that individual. In my work with populations of addiction, we try a lot of things to develop new coping skills, develop new activities, to insert and add to the person's life, so that they're able to cope with some of the troubles, because some of the troubles that go on inside of them are causing problems. And this is good for them. So a client who comes in who would really benefit from that teaching of coping skills, even mindfulness practice and whatnot, this wouldn't really be a great fit for them. Another limitation is from a managed care perspective. There's no treatment planning, there's no diagnosis in a pure person-centered approach. And to be fair, I don't think I know a single person in my professional personal life who practices a pure person-centered approach. So you really wouldn't be able to bill for this stuff, right? And my personal perspective is that treatment planning is really important, and sometimes it's something that gets thrown off to the side and not really taken, very seriously. But that's really important to understand where I'm going with a client, for me to be assessing constantly and analytical in my own approach with the client to assure that we're doing good work and we're going in a direction that benefits the client. I believe that's my job. So for me, this really isn't a great approach and a pure perspective. But I mean, I incorporate a lot of these principles with every client who I work with because I want to develop a relationship. I want to be as facilitative as possible within other theory I might be practicing at a time, right? And back in the day, we're talking a long time ago, geez, like maybe like 70 years ago now, we're highlighting things that today we're still focusing on: the quality of the relationship, a lot of the basic skills of counseling. And these are the necessary ingredients for successful counseling, that any theory, in my opinion, and supported by some literature out there, should be respecting. So it's really important to keep that in mind.